Mimi is a 7-month-old, spayed, female domestic medium-haired cat that presents for vomiting and blood work is performed. As mentioned for other cases, one should consider reviewing the ProCite IDEXX dot plots before reviewing the CBC data. Dot plot reviews provide confidence in the hemogram data that is essential to assure correct interpretation, and there are readily recognizable dot plot patterns that reflect important underlying cell morphologic abnormalities. Here, we're looking at a white blood cell dot plot where between 10,000 and 15,000 individual white blood cells are characterized by their nucleic acid content and selected morphologic features. Each leukocyte's fluorescence is measured and displayed on the y-axis of the dot plot. The greater the amount of RNA and DNA, the higher digital signal of the white blood cell travels on the y-axis. The x-axis is a measure of light scatter based on the laser interrogation that primarily provides information on the degree of granularity or complexity of the cytoplasm. In the healthy cat WBC dot plot, there's a defined cluster of cells colored purple that represent neutrophils, separated from another cluster of cells colored blue that represent lymphocytes. In comparison to a WBC dot plot from a healthy cat, note the difference in Mimi's dot plot, in which there is no clear division between the clusters of digitized events identified as neutrophils, purple dots, and lymphocyte, blue dots. The cluster appears to be a single population of cells with a continuum of digitized events extending upward from the normal location of neutrophils. This change in the dot plot pattern reflects increased RNA content in the neutrophil population, a difference that, compared to normal mature neutrophils, is present in immature neutrophils, including bands and earlier forms, as well as toxic neutrophils. The increased RNA in these younger or toxic neutrophils results in increased fluorescence. As such, these cells are then located higher along the y-axis and consequently overlap with the normal lymphocyte cluster. This overlap is due to the ProCite's inability to definitively delineate the two different white blood cell populations. As with all hematology analyzers, normal cell features are used to train the analyzer in cell classification. Immature and/or toxic neutrophils with increased RNA content are abnormal, and the analyzer recognizes some of these cells migrating in the known lymphocyte region. The end result is that some of these abnormal cells are being classified based on their location. Although the absolute numbers of neutrophils, underestimated, and lymphocytes, overestimated, are incorrect, the dot plot pattern provides much greater valued insight in the presence of immature and/or toxic neutrophils. This hallmark of active inflammation would not have been identified when just looking at the numbers. The diagonal line that rises to the right between the purple neutrophils and blue lymphocytes is the result of the analyzer's training as to where normal neutrophils and lymphocytes should be located. This particular pattern, which can be seen with moderately severe left shifts, has been nicknamed the shark fin because of the obvious similarities. As the degree of left shift or toxicity becomes more severe, the cluster of neutrophils extends further upward along the fluorescence y-axis, and this pattern may be lost. This additional WBC dot plot information is critical to remember and identify, as in some cases, such as Mimi's, the reported numerical values for the total leukocyte count and neutrophil count may be within the reference interval, and without recognizing the abnormal pattern associated with inflammation, clinically important inflammatory disease can be missed. Indeed, we can see from Mimi's blood film that day that she does have immature neutrophils, or bands, present in circulation, noted with arrows. Prompted by this detection of significant inflammation, radiographs and abdominal ultrasound are performed, and Mimi is diagnosed with gastroenteritis, without an obstructive pattern, and hospitalized with medical management. When we look at Mimi's dot plot on the CBC repeated the following day, we see the pattern noted above that is associated with an increasingly severe inflammatory process. In Mimi's leukogram, there is a reported severe neutropenia, a high normal lymphocyte count, and a minimal monocytosis. However, all three of these white blood cell results have an associated asterisk next to them. These asterisks indicate a recognition of an abnormal white blood cell distribution, which in this case is associated with a significant left shift and banned neutrophils suspected is reported. When the asterisk qualifier is provided, the user is instructed to verify numerical results with dot plot and/or blood film review. In most situations, dot plot review provides a valuable insight into the abnormalities present. In this case, the abnormal dot plot pattern reveals a continuum of dots with blue dots on the bottom and red dots on the top. Even though there are no digitized events in the region where neutrophils typically are located, it is relatively easy to suspect that the neutrophil cluster has moved further upward on the y-axis compared to the day before. Additionally, there is a sparse cluster of digitized events to the left, where the lymphocyte digitized signal should be located. The identification of the low number of digitized events associated with lymphocytes provides added evidence that the larger abnormal cluster represents immature and/or toxic neutrophils. With this current CBC, there is an underestimated count for neutrophils, as well as an overestimated count for both lymphocytes and monocytes. So be careful. Severe acute inflammatory conditions may present with what appears in the automated data to be a neutropenia and either of these ProCyte WC dot plot changes. Don't be fooled. The ProCyte's flag for bands is significant and should prompt you to review a blood film in such cases to confirm cell identification. However, once a few normal WBC dot plots are seen, abnormal dot plot patterns seen with severe inflammation will also prove to be of huge value in assuring a correct interpretation of the leukogram is made. In comparing WBC dot plots from various inflammatory conditions, one can appreciate the progressive shifting of neutrophils further upwards along the y-axis and into the expected lymphocyte cluster. This results in a steeper angle to the line dividing these two populations as the severity of the inflammation progresses. It is notable that the steeper the angle of the line between the neutrophils and lymphocytes, the more severe the inflammation and the increased concern for toxicity. The ProCyte's WBC dot plots provide significant diagnostic information to augment the automated data. Trending of a patient's dot plots over time provides invaluable diagnostic information for the clinician as to efficacy of treatment regimen and/or disease progression.